Hi, my name's Amita Singh. I am from NYU Langone, and I'm representing the prevention department within cardiology. And what I am presenting today is a project about basically 5-year follow-up after gastric banding. And the reason for that is we know that in the short term, patients do well. We know that it reduces their cardiovascular risk. They come off of medications. But actually, lipid effects are variable if you look at different studies. Depends on surgery type, depends on baseline BMI. So our goal was to really provide sort of a contiguous and longer term picture of what happens. And what we were able to show in 50 patients who had a BMI that ranged between 30 and 40, so that's definitely on the lower side compared to other studies, was that in the short term, really within a year, they lost about 50% of their excess weight loss, which is sort of the standard amount attributed to gastric banding. And in association with that, both in the short and the long term, meaning for this study, 2 and 5 years is how we define that, they had significant increases in HDL cholesterol early, significant reductions in triglycerides early. We were hoping to see that maybe over time with weight loss, LDL cholesterol would improve. Unfortunately, we didn't demonstrate that, but that is pretty consistent with gastric banding studies. The reason for that, some people believe, is due to the fact that gastric banding doesn't really alter your cholesterol absorption, and the malabsorptive surgeries do. So on some level, it's actually consistent, although it's disappointing. I still think, we saw improvement in patients, particularly with the metabolic syndrome. They had a greater magnitude of improvements in their HDL and triglycerides over time, and that was sustained. So to us, I think it's nice evidence that even a couple years further than what we typically think, a lot of these changes we see early really do persist. And also the weight changes persisted, which was kind of nice to see, because we sometimes worry about weight regain after a few years, after follow-up starts to space out, and we didn't really see any of that. So to us, I think kind of a mixed bag, but overall supports, I think, improvements in lipid parameters. The other thing actually worth mentioning is 20 patients were on a statin at the beginning of the study, and at 5 years, only 7 were. So 13 patients were able to come off of their lipid-lowering therapy, which I think speaks to sort of the sustained effects of the surgery, and also sort of adds to the arsenal that a lot of these patients can come off of medications to manage cardiovascular risk because they do better.